Hi everyone. So I focused my capstone project on improving communication tactics and mental health in impoverished communities. So basically the issue I was focusing on was the idea that communities that are burdened by poverty face a substantial lack in access to healthcare. And not only do they face a lack of access to healthcare, but they also lack the ability to find resources about healthcare topics, how to reach out, how to afford healthcare, especially education on diets, how to prevent like certain diseases, things like that. And the one issue that I really wanted to focus on is mental health, and that's because a large portion of people who are living in poverty do suffer from mental health issues just because of how stressful it is. Financial concerns, stuff like that, really weigh on families and can be damaging. And on top of this too, when you are suffering from a mental illness, it's that much harder to seek out help. And when you're living in poverty and no one's really offering you that help, it can just go down a really bad road. And on top of this too, things like COVID and inflation have made financial issues a lot worse for a lot of people living in poverty and have really sparked new worry and stress on a lot of families. So what we already know from researchers who have talked about this topic is that there's just a general misunderstanding across all types of people about mental illness and how to identify mental illness. There's still a stigmatism towards mental illness, and a lot of times because of it, people don't like to address their mental concerns with a healthcare provider. So, really just a huge thing that researchers have looked into is just how people aren't willing to talk about it because they feel that there's a negative connotation behind it. So for my methods section, I pretty much just use an interview process where I had around 8 to 12 questions that were open-ended that really let people share their opinions about kind of the healthcare system, their experiences living in poverty, how they've been treated by doctors, how confident they feel in the healthcare system itself. And I focused this on two groups, so the southwest region of Ohio and the northeast region. Both of these regions allowed for both like an urban and rural atmosphere where I could kind of look to see if there are any differences. I also use my own experiences in my methods as well. Well, I pointed out that I was going to use them because I have had my own experiences with this, so I thought that it would be beneficial to share them. So I did some journaling and stuff like that just to be able to include them in my results and my discussion. So, in my results, I had 3 key themes, which were stress, poor communication, and general financial concerns. So these were the 3 things that I saw came up the most throughout people's writing, or they might not have necessarily wrote it, but it was implied from what they said. So I'm not going to read all of this on the slide, but feel free to read it. This just goes in more into depth about what people were saying and gives more context to the 3 themes. But basically one thing I did want to point out is how connected the 3 of them are, especially stress and poor communication, just because a lot of times people are stressed out because their doctors don't provide them with proper communication, or they feel like they don't understand a diagnosis or understand how to access healthcare. And the same goes actually for financial concerns as well, that causes stress. And they're all kind of just linked together, and really tackling these 3 issues is what's key to bettering mental health and improving communication. So, the next question is, what else did people say? Because obviously there's more than just those 3 key themes that I identified. But people also addressed issues like being denied from healthcare and not being offered resources for how to seek help elsewhere. So I did have one respondent who talked about seeing a doctor for a long time and then switching insurances, and the doctor saying you're out of luck, we can't really help you, I can't see you anymore, and basically we're not going to really offer you any options to seek help elsewhere. So this obviously is a huge issue for a lot of people, especially when you can't afford to see a doctor outside of your coverage. And a lot of times too, doctors don't really care about whether or not you can financially afford them. And they don't really ever offer options to seek help elsewhere. So, like I said, this is a huge issue that needs to be addressed, just so people understand their options for healthcare and don't feel lost or isolated or like not knowing if they're ever going to be able to receive treatment. Participants also commented on a wide range of mental disorders that have been neglected amongst themselves or a family member due to their financial status or lack of confidence in the healthcare system. And on top of this, many also stated that they feel they struggle with mental health issues but are unable to identify or treat the issue because they simply don't know how to address it. So once again, going back to this, like we saw from previous researches, a lot of people don't know how to identify their mental illnesses, and when you're living in poverty and lack these resources, it makes it that much more difficult. And on top of this, when you are struggling financially, a lot of times you don't prioritize your mental health. You think about other things like what you're going to eat that week, like paying for gas, and a lot of times people push aside health issues in order to pay for things that they think are more important. So, moving into my discussion, after looking at all of my interviews and results, I really tried to identify places where communication could be improved outside of the healthcare system, because obviously doctors need to do a better job addressing those topics that I discussed, but it also needs to be improved in schools, in the workplace, and on social media. So these are 3 places that I identified as places that a lot of people spend a lot of time, no matter your class or your socioeconomic level. Pretty much all kids go to school, most adults work, and most people, especially with public Wi-Fi and wider access to technology, are on social media. So by using these 3 places as a way to communicate about health topics and offer better communication that's more catered towards people who are living in poverty, it can really benefit them by making them feel comfortable and confident in receiving health care. And basically, when you improve communication, it'll result in improved mental health and health literacy in impoverished neighborhoods. So it's kind of parallel to each other. One results in another. When you improve communication and make people more confident, their mental health will improve because one, they're going to be seeking out help, and they're going to just feel more confidence that they are connected to somebody, that somebody cares, that they're not as isolated and stressed out as they thought they were. And basically the best method to attempt to improve access to healthcare and overall wellness of impoverished individuals is to start by improving communication and confidence among patients. This must be done by using the most efficient and appropriate language and channels of communication. So I wanted to end with this point, just because a huge thing that this will never work if you don't use the language in the way of communication that will best suit your audience, which my audience in this case is people living in poverty. So if you're writing in medical terminology and just like words that people living in poverty aren't going to understand and they're not going to be able to feel confident in their understanding of, then you're never going to get that reception back from them. So that is the most important thing. And overall, my whole argument, I guess, of my project is just that there's a lack of awareness and research on how communication can be improved in impoverished communities. So moving forward, that's something that I think researchers really need to focus on. Obviously, my research is just for class, but I think that it would benefit them to kind of research the same topic and do kind of the same method as I did and find out more about what they can do to improve communication and improve mental health. So that is all. Thank you.